I just wrapped up the 12 bullet points of finding and keeping really good quality staff. And I realized that there are common traps. And I shared this when I presented this to the group of doctors. And I need to share that here. That's not fair to just give you those two sets of bullet points and not let you know what to be on the lookout for as far as common traps or common can't talk common problems that show up when you're managing a team. So let's go through these, the common traps to avoid, the common challenges to avoid when it comes to finding and keeping good quality team members. 6 points here as well. Number one, do not ever make a friend of your employee. Now, I understand you're going to get close to people. I also understand that sometimes you hire people that you know outside of the office, but just like your patients, if you make a friend of your patients, you see how they change in their attitude, you see how they change in their demeanor. Maybe you have treated, here's a good one, you've treated family and friends in your office. Let me ask you, do they follow your recommendations? Do they keep their appointments like clockwork? Ooh, do they even pay you? See, we hate working with our family and friends because there's no authority there. There's no respect there. There's all that love, but you don't have the other things supporting the relationship. If you make a friend of your staff, you're creating the same dynamic. You have to be a friendly doctor without being the patient's friend. You have to be a friendly boss without being your patient's friend. If you lack socialization, if you are in desperate need of talking with other people and having adult conversation that's not patient care, find you a hobby. Join a bowling league, get active in your church, join a book club, but do not make friends of your staff members because you will lose authority and you will lose respect even amongst the best people. That happens. That's a psychological phenomenon. Number two, do not spend idle time at the front desk. I mentioned this when I was talking about the keeping good staff members. The more idle time you spend at the front desk, the less what? Your employees are actually working on their things. They're talking to you. They're listening to you. You're the boss. The boss comes up to the front desk. They're going to stop what they're doing. They're going to look at you. If you tell jokes, they're going to laugh. If you tell stories, they're going to seem interested. But in the back of their head, they're thinking, I've got all this to do. When is this Yahoo going to shut up? They're just not going to say that to you. Employees don't talk like that to bosses. Mostly. Some do. But you don't want to spend idle time at the front desk. If you don't have anything to do in your office, then pace the floor and say a prayer for God to send you some new patients. Right? Get out there and do some marketing. Get caught up on your reports and your notes. Run the vacuum. Scrub the toilets. Don't sit there at the front desk chit-chatting, chewing the fat because you, again, turn them into friends and you reduce their productivity and you confuse them about the relationship that you are in with them. You don't have a relationship with your staff outside of being their employer and possibly being their chiropractor if treating them as part of what you do. Number three, do not attempt to rehab staff. For every 1,000 staff members that go south, and some do, sometimes they go sideways, we've found the right person, we've trained them, but they've got personal things going on in their life and drama in their life that is just absolutely destroying who you hired. And you hate it for them, and your heart goes out to them, and they're so distracted, they're screwing up the clinic. They're not recording things right. They're messing up on their till. The reports are all sideways. So what do? Well, she's such a good person. He's such an amazing. All the patients love him. So we get into staff rehab. For every one staff that you salvage, there'll be 999 that you can't salvage. And typically what you get into is a little bit of a roller coaster where you invest in them and you have that come to Jesus talk and you get on the same page, and then they do better for a few weeks or months, and then it comes back. And now you're up and down, up and down, up and down. Do not get into staff rehab. Get into patient rehab. That's what you're trained to do. That's what you excel at. Sometimes we hire the right people, and through no fault of our own, they become the wrong people down the road. Let them go. It hurts. It's no fun to let people go or fire them. It's probably the worst part about being an entrepreneur or a business owner, but that's what your business demands. Every day, the wrong staff member is there at the front desk or there in the therapy room. It is patients who are losing. It's not you. It's not revenue. It's patients who are losing the opportunity to really get their health care back and keep it back once and for all. And that's your priority in the clinic. Number 4, do not ignore stats or your daily reports. The system that I coach, the system that I implement, has stats. We recommend have stats, either or. We recommend that the doctor should be getting daily reports from their staff. And those reports are very detailed. These are the things that you want the doctor to have on their desk at the end of your day or at the beginning of the next day. Doctor, don't ignore those. You need to know what's happening there at the front desk without micromanagement, without standing up there asking and calling out, what is that number? What is this number? Look at your reports and look at your stats. Doctors who don't know where their stats are, doctors who don't know what's in their reports, have no idea where their career is headed. And that's not a very comforting feeling. Give yourself comfort, give yourself peace, give yourself a spirit of, I can do this, I know exactly where I'm headed in this world, by looking at your stats and looking at your daily reports. Number 5, do not micromanage. I've hit this hard on another recording, but no one likes being micromanaged. No one really likes micromanagement. The people that I find micromanage others, they're really doing that to keep their own anxiety at peace. It's like, I've got to spin all these plates and I've got to make sure that they're spinning, and I'm the only one who can do it because I can't trust anybody else, and I've been burned in the past. And stop it. Stop the insanity. Get off the micromanagement cycle. The way you break that is you train and you follow up. You train, you equip your people to succeed. Give them every tool to be successful in that position, and then you follow up and make sure that they are using and following those guidelines that you trained on. And if they're not, well, then you retrain, or you make a decision that maybe is hard to make. But the last thing you want to do is get into a micromanagement where those staff members have no autonomy to make their own decisions, have no autonomy to follow and use their judgment and discretion in the office. That's bad, and you're not going to keep good people. In fact, you'll take some really phenomenal people and you will absolutely poison them because you're creating stress in the office. So, number 5, do not micromanage other people. Number 6, do not override your system policy, your procedure, your protocol. Once you have procedure, policy, and protocol in place, whether that's coming from a consulting firm or a patient management firm, whatever, do not override that policy without talking to a coach or someone who created that policy. People who override the policy because it makes them uncomfortable or they're not sure that should apply to them create more problems than they solve. That policy, I can promise you, is there for a reason. There are the whys and the hows behind it, and when you choose to deviate from that policy, you are choosing to invite uncertainty into your practice when it comes to the business side of your practice. So once you have policy, procedure, and protocol in place, whether that's something you learn from a third party or that's something that you've developed on your own and it's rock solid, once you set those policies, you do not deviate from them or break from them as a policy. Now, every clinic has that special case, that case-by-case situation where it doesn't really fit neatly into that previous policy or that previous protocol, and you just handle those as they come on a case-by-case basis. But really, you want to have your policy, your protocol and your procedures, do as much heavy lifting as possible in your office. If you will avoid these 6 traps, these 6 common challenges in running your office and leading a team, you will have a happier practice, you will have a more satisfying career, and you will have longer term staff members who get that coveted buy-in. You know, the ones that really get it, they get chiropractic, they get you, they get what your clinic is all about. You will be able to find those people, keep those people, and avoid some of the traps that push those people away. I hope this has been helpful for you. I am here to serve you. If you have any questions or anything that you need from me, let me know, and I hope you have a blessed rest of your day.